Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to Future First, Focus on Broward's Children. Today we're talking about children's mental health. Just like physical health, mental health is an essential part of a child's overall well-being, starting at birth. From managing stress and anxiety to building resilience and healthy relationships, supporting a child's emotional health helps them thrive at home, in school, and in life. The good news is that no family has to navigate these challenges alone. Here in Broward County, caring professionals, community organizations, and evidence-based programs work every day to ensure that children and families have access to the support they need, whether it's counseling, family services, early intervention, or, if necessary, crisis resources. At the Children's Services Council of Broward County, we're proud to invest a small portion of local property tax dollars into programs that strengthen children's mental wellness and help families build brighter futures. Joining me today are local experts who will discuss the importance of recognizing the signs that a child may need support, reducing the effects of childhood trauma, and connecting families with the resources available right here in our community. Welcome to Jarvis Brunson, founder and CEO of the Change Me Foundation, Dr. Harleen Hutchinson, Executive Director of the Journey Institute, Suzette Fleischman, CEO of the Broward Behavioral Health Coalition, and Dr. Maria Angelica Mejia, Clinical Director, Adolescent Wellness Academy. What a great panel. I am so excited about this. I, in fact, just got a text from my daughter seeking help as she manages her college experience. And so it doesn't stop. I always say parenting is the toughest job. It is not for sissies. There is no shame, yes, but there is no shame in asking for help. Suzette, I want to start with you because the Broward Behavioral Health Coalition is sort of our umbrella here in Broward County, the managing entity. And since you are in your second week as CEO, I thought I would test you on what you know about the Broward Behavioral Health Coalition.
Sure thing.
So tell us about what the role is of the managing entity.
Sure.
And how, I mean, people don't usually interact directly with Broward
Correct.
Behavioral Health, but how do you organize the system as we look at it as a system?
Sure. So under Florida Statute, Chapter 394, the managing entities were formed by our legislature, and we get funding through mainly the Department of Children and Families to create a system of care that addresses the needs in the community. As such, we are required to conduct a triennial needs assessment and update it annually, identifying priorities for the system of care, as well as what we can do to enhance the system of care. So we work with our local communities to establish the much needed services, and it's an array of services, starting with psychiatric, inpatient, which is the most acute care, level of care, and detox as well on the substance use side, and then all the way to outpatient services and community resources. We have peer support. We have a lot of recovery supports that are offered in our community. We partner with the Children's Services Council to create trauma-responsive communities, and United Way of Broward County is the provider that is conducting those cohorts to work with our provider agencies across our system of care to ensure that wherever a parent, a family member, a child goes into the system, that they are met with trauma-informed, trauma-sensitive providers, and providers that can address their needs. So we focus on, from birth, the importance of being sensitive to the mental health and well-being of those infants and their families to help them address them, their well-being. We want parents to be responsive to infants because, as you said in your introduction, it does start at infancy, and it allows them to be curious with their environment. It allows them to form secure attachments, which then builds on positive relationships as they grow older.
Great overview. And when you talk about childhood, infancy, trauma, I must bring Dr. Hutchinson into this conversation. I know you could talk for an hour on this, but let's have a little overview of the importance of the first 1,000 days.
Well, thank you for asking that. A lot of us really don't understand the first 1,000 days is very critical to childhood development because it lays the foundation for the adult years. And we know also within the first 1,000 days, brain development is taking place. And we already know also when a child enters kindergarten, 90% of their brain is already developed. And wow, we ask ourselves, here you have Johnny entering kindergarten at 5, and his brain is already developed 90% of the time. So if Johnny's entering and having all those behavioral issues, we ask ourselves, what happened prior to Johnny entering kindergarten? So it's really important that when we think about the first 1,000 days, that we're really providing opportunities for children and their families to really intervene because brain development is taking place. Brain development also, little ones need the co-regulation to really deal with those big emotions that they might be experiencing. And executive functioning is taking place. We know here in Broward County, a lot of our little ones, a lot of our families are plagued with a lot of trauma. They are plagued with toxic stress, homelessness. All of those things impact little ones. Like Suzette was saying, those early intervention really is important. So the idea is, you know, systems like CSC and BBSC, once we start intervening early and providing opportunities for providers and for families in Broward County to really provide that level of support to really strengthen their family, then the outcomes is going to be better. We're really building a community where Broward could be the forefront of other communities, leading the nation with what it means to be seen, what it means to really cater to families and start early within the first 1,000 years. They're a critical period for a young child's life.
You know, a lot of people don't understand. I mean, you talk about trauma and we talk infant mental health, and they're like, oh, come on, infants don't have mental health. But they do. They're responding to the environment around them. And there's also been a lot of research into adverse childhood experiences known as ACEs. So I don't know if you want to come into that conversation. You want to start there and then how that shows up in adolescence?
Well, absolutely. We're just even a very quick example that we can all relate to is the pandemic, right? Right now we're seeing 13 to 18-year-olds that suffered the consequences of isolation, right? In their younger years, right? In their elementary years. So they're coming in at these ages at Adolescent Wellness Academy. We see them as, we get calls for kids from 10, 11, 12, 13, and they don't know how to communicate. They don't know how to socialize. They have social anxiety. They are exhibiting the consequences of, in those foundational years, not learning how to communicate with anybody outside the home. And that's if their home life was healthy, right? The majority of the times there was food, lack of resources for food and stability and safety and the parents' own mental health. And so now we're just beginning to see what those consequences are because we have kids that come from stable homes but are just afraid of the world. And so just with the pandemic, and let's just add all the other ACEs that can possibly happen, we are seeing massive impacts, and we don't have a rule book for that at this moment in time because now we're dealing with AIs and we're dealing with social media and we're dealing with electronics and school systems that are overwhelmed, and the list can go on.
And one of the things that's also been a bit of a barrier is the idea of stigma and people thinking mental health somehow is scary. I can't admit that I'm struggling. And it doesn't mean that you're going to go out and shoot up a school. It's mental wellness. And Jarvis, you've been on the journey of destigmatizing mental health for 20 some odd years now. So can you talk about that and the Change Me Foundation?
Yeah, so I think I've been involved in Broward County for about 23 years now. When Broward County applied for a federal grant, One Community Partnership, a SAMHSA grant, looking at system of care, and starting as adolescents, as we talk about trauma from the death of my mother, and looking at what that looks like, reflecting myself and my community on how we process trauma, but how do we navigate services. So I took, in 2020, I took all the years of experience that I learned. I started an organization called Change Me Foundation, and our mission is to educate, advocate, and empower youth and families to their full success. And what that looks like is we really teach individuals and families how to advocate for the services that they need. How do you navigate Broward County and the services that's out there? And so when you look at an IEP meeting, how do you go about the process of that? And when you go about the process of that, how do you continue advocating for your child in that process? So we continue to do that. Over the years, we have spent, and since 2010, my mission has been to reduce stigma in our community. And I started Walking My Shoes, which is a 5K walk. At first, it was starting walking in our community, getting the residents and individuals to know that, like you mentioned, we're not going to go shoot up something or harm someone, but we live everyday life and stressors, and so how do we handle that? And so the barrier of just saying that you have a mental health or depression or anxiety comes with a heavy label, and so how do we feel comfortable talking about that? And so what we do is we really walk to reduce that stigma, just like you have someone with cancer or you have someone with high blood pressure or diabetes. It's just as simple as that. And so now, 10 years later or so, we have really worked to bring out the community itself, running communities and advocates to come out and walk. And then we have community providers, so everyone can come out and get resources from health and wellness to fitness to primary care while you're at this event. So our goal is to continue to raise awareness throughout Broward County, where every provider and every family in our community knows that it's normal, just like any other health initiative.
I mean, let's face it, we all have brains.
Yes.
And we all face stress every day. And we all need help on how to cope. So to create shame about it is just crazy. And for adults with babies, with infants, Dr. Hutchinson, I mean, that shows up with your child. So can you talk about, again, people think infant mental health, what does that mean? And how can you improve an infant's mental health? But it's about the parents and the child. Can you talk about
Cindy,
that?
that's a good question. You see, when we talk about infant mental health, you're absolutely right. People go, children have mental health issue, and then the first thing they start thinking about a baby on a sofa, right, in the doctor's office. But infant mental health is not necessarily all about that. Infant mental health has taught us that young babies function in the context of caregiving relationship. So if mommy or daddy is stressed, babies are absorbing that. So when we think about the idea of infant mental health, we're talking about those social emotional struggles or challenges, because babies don't have words yet to say, hey, I'm really having these big feelings because I just saw daddy hit mommy, or I just saw mommy overdose. Baby doesn't have the language. So it shows up in their behaviors. It shows up in the way they interact with people. It shows up in their bodies because their nervous system is actually absorbing all of those things. And it also shows up in the way they respond to folks. And usually these are the babies or the young children that we see in our community that really have severe behavioral issues. So one of the things that I like to tell adults or even providers or folks, always ask, what has happened to this child? Because little Johnny didn't get up and say, I'm going to give you a run for your money today. Right? They didn't do that. But something happened that he's not able to articulate, saying, this is all the big things. This is what happened. And it's really scary. In Broward County, as we think about infant mental health, we are seeing the homeless crisis for the little ones that are sleeping in cars with their moms. So these are little ones that are experiencing social emotional challenges. We're also seeing little ones that have exposed to domestic violence, and even the substance exposure, right? What it does to little ones. But another thing that I want to touch base on, we talk about ACEs, right? Adverse childhood experiences, right? And in terms of the little one, what we look at with the ACEs, we look at the parents' ACEs, right? So if the parents have a high ACE score of 4 or higher, we know that child is at risk for having some kind of social emotional challenge, so we want to intervene early. But the flip side to that is we're always talking about the negative, right, which is the ACEs. But there's also PACEs, something we call PACEs, positive childhood experiences. So one of the things we try to do is really ensure that this baby or this child is being buffered by a caring adult in their life to really mitigate the experiences of ACEs. So that's what I want to really impart on the audience, that once we have ACEs also, one of the good things for us to do is to really ensure as providers and even as a caregiving adults to make sure that this child is being exposed to nurturing caregiving environment or adults in their life to really buffer those things. It goes along with having two children in the same household and they're placed in foster care. One does better than the other one, right? The one that didn't do well because that foster home wasn't caring and nurturing. And those are the way buffering relationship works. Those are the way infant mental health challenges shows up. So we really need to start early and intervene early to really mitigate the success and really demonstrated good outcomes for children.
I want to pursue that a little bit for tips for parents who may be watching who have young children at home and who don't perhaps recognize that if they come home angry, stressed, that they are transmitting that to their baby. So, and to any of you, what are some tips for parents of infants that can really help with those paces, if you will? I mean, we'd really like to not have the children be removed from the home and wind up in foster care. So what are some of those tips for a parent?
So one of the things that I like to tell parents, parenting is never easy, and parenting did not come with a cookbook. And one of the things that I also want to impart on them, they're doing the best that they can with what they have known, right? So when these things happen, the best thing for parents to do is to make sure they're regulated because children need co-regulation, right? If mommy's not regulated or daddy's not regulated, the child is not going to be regulated. So we tell the baby, if it's an infant, swaddle your baby, take a walk. Or if baby's an infant and is in mommy's arm or daddy's arm, we say do some belly breaths. Breathe in and breathe out. Breathe in, because while you're regulating yourself, baby's also regulated. So those are some things. And it's okay to also make sure that baby's placed in a safe sleeping position. Put babies down for a minute and then regulate yourself before you interact with that baby. Because like you said, Cindy, if mommy or daddy's not okay, that baby's absorbing all of those stressors. And that's the way we actually pass those toxic stress onto the baby at that early age. So we want to make sure the first person to be regulated is the caregiver. And that also goes for the school environment. The first person to be regulated in that nursery is the preschool teacher. You got to regulate yourself before you interact with the child.
So true. I really love that idea because we provide the same guidance to the parents of teens. I love it because the parents of teens come and they're like, nobody prepared us for teenagers, right? We got all these books and all these manuals about how to work with infants and how to feed and check the poop and all this, but nobody gave us a manual for teens. And one of the biggest things, because when they're teenagers, then they start fighting back, right? They can verbally fight back, and then parents, we say, regulate yourself first. Because you're fighting with a 13, 14-year-old as if they were your equal, and they're like, well, they shouldn't be doing this. And then comes into the stigma and the beliefs and the culture, like they should be respecting. And then they are completely dysregulated, and it just gets so out of hand that many times the cops are involved. A Baker Act happens. A child is taller than mom, and then kid pushes mom thinking that he has the same strength when they were 7 and now he's 15, and then they're part of the legal system. And so one of the biggest recommendations I have to parents is regulate yourself. Maybe kids have their own rooms. Make sure they're safe in their room and regulate yourself before you interact again, because they forget that they set the tone. And then teenagers never forget. A parent says something out of anger, and I've heard this happen so many times. They said, my parents said I was A, B, C, or D. And then that becomes their inner dialogue and this sense of low self-esteem. So yes, co-regulation, I think.
And I like how you said teenagers don't forget, right?
Babies
don't forget. If time permits, if it's okay, I like to share a story.
Sure.
So I like to share a story about this 8-month-old baby that was exposed to domestic violence. And when the baby came into care, the mom says, my baby didn't see anything. Baby don't understand. Baby started coming to treatment. Every time the baby come to treatment, the baby was banging her head on the wall. Yeah, the cushion wall. That went on for a couple of weeks, about 4 weeks, and then the fifth week, the baby, there's a language that we use, intervention called Speak for Baby, right? So the baby banged the head. I said to the baby, I spoke for the baby. Mommy, I'm really angry because I saw when Daddy hit you in your head, and it made me sad and it made me cry. You didn't protect me. Mommy looked at the baby. The baby looked at Mommy. Mommy goes, why is she looking at me like that? I said, Mommy, babies remembe. So I said, why don't you tell her you're so sorry that you didn't protect her and give her a hug, right? As soon as she said that, baby moved over to Mommy, gave Mommy a hug. Baby started crying. Mommy started crying. Mommy says, I didn't know she understood. So babies remember, their bodies remember. Consequently, the following week, baby stopped banging head because young children need someone to bear witness to their pain. They just don't have the language. Just like teenagers, like you're saying.
Absolutely.
They need adults to bear witness to their pain and normalize their pain and saying, hey, this is what I'm going through.
I love that story, because, and what you're sharing, it transcends across the ages, right? When you think about it. And it's important to be able to relate to infants, children, adolescents at their appropriate age. It's important to acknowledge and validate what it is that they're feeling, again, at their age, appropriate age. And that's when you start, we talk about infant mental health, we talk about it starts at birth, but it has to happen right along. And Jarvis, you're working on, working with families and breaking the stigma. That right there starting at birth starts to break that stigma. It allows it to be natural because mental health, as you said earlier, is health. And it does pave the way for lifelong health, learning, relationships, positive relationships, and resilience, because all of this speaks to the coping that parents can demonstrate to their children, how to regulate, talks about positive coping skills.
And also, it also speaks to the fact that language matters, right? We talk about trauma, and what we know in certain communities, you can't even use that word, right? So language matters. So it's like you're saying, it's really learning how to connect and really understanding what the community needs, what the families need to help them make sense of. I mean, when they come to me, the first thing, most of the families that we get, they're court ordered. Dr. Hudson said, I don't have trauma. I said, it's okay. I know you don't have trauma. Right? By the time they finish, right, they recognize what trauma looks like. Because they see it as stressors, and we talk about these are stressful events that actually manifests itself like that.
And we see that.
Let me get Travis.
So I was going to make a point that Suzette said. One of the things that we do have to do when we're working with our families, that we have to make sure when we talk about mental health, we have to make sure that it's a natural conversation. And so that when we're bringing up anxiety and we talk about the trauma, it's already a stressor for some of our families. And so some of the work that we do is try to make sure the conversation is natural as possible, so that families can feel that it's more normal. And because when the first thing you talk about when you say mental health, it's already like a high alert for them, right? And then now when you talk about, an infant, a mother saying they're displaying mental health, then it becomes a standoff. When we look at any culture, talking about mental health, already puts up a high alert. And so when we come in the conversations of natural conversation, and it's just a natural conversation you're having with them, and talking to them about some of the things that they can look at from a natural standpoint, from infant. When you walk through the door, you may need to take 5 minutes in the car and just breathe, right? Or when you're home, just take a moment and sit there and breathe with your child. And so that may be something just natural. And they see, okay, mom's calming, okay, so I can be calm, or dad's calming, right? And so some of the things that, that I learned, with my daughters, working in this field, we go through a lot of, stress and high alerts. And so, my kids always say, how's your day? And I'll be like, ooh, or I'll say, great, right? But I had to learn, talking about, having a 15-year-old daughter that was diagnosed with oppositional defiant disorder, right? And what did it look like for her, right? Hearing that, and she was like, what? But having that label, because she often spoke up and challenged, in school, that, I had to explain to her, that that's just a label, right? But you're so much more than that, right? And look at, your artwork that you have. And so having this natural conversation that don't let that define who you are, as a person, but you have an outlet to do, right? And so your outlet is drawing, right? And so we have to look at what are some of the natural supports that our kids can go through and look at, horseback riding or basketball. For me, it was track, right? And so for my 15-year-old daughter right now, it's art. you know, and so she's like an artist, right? And so I used to joke with her and say, oh, that's a nice stick figure, and, you know, just to make her laugh, but she's actually, you know, really mastering it, and so it's how do we get our young kids to really look at going back to some social emotional learning, but doing it in a natural setting so they can feel more calming about it.
And that's one of the things that I recommend to most parents is kids need a community that feels like them.
Yes.
And, you know, based even on how to communicate that. So at AWA, we deal with severe like mental health. So by the time that the parents come to us, like their kids have been like Baker acted, they've been involved in the legal system, they've been in and out of outpatient care, they've entered their first episodes of like psychosis. And I like how it's having a natural like conversation, because since we are a trauma-informed, family-focused program, many times they are like, okay, my kid is the one that needs to get fixed. And then in the process, because we require them to do parent coaching calls, and we do parent support group, and there's a lot of parent workshops and education and family like sessions, they're like, I didn't know that was trauma, or I didn't know that my trauma that I experienced in when I was a teen or early, you know, adulthood is impacting now my parenting here. And when it clicks for parents, it's like a transformation in that family like system. And then they're like, what now? And they think that they're broken. And we're like, no, the awareness is the hardest part, because now that we have awareness, then you can change the pattern. And many times that pattern is finding communities, because I think that even we do all this support for the kids and for the toddlers, but I think that we also need to be supporting the parents, because the parents are just like, I lost my village. It takes a village to raise a child, and I don't have a village. And I think that there has to be something where we're also building that community, not only for the kids and arts and in sports, but also a community for parents to just be like, I don't know what I'm doing and I want help. Without it being like, I'm not good enough.
Right.
But I also want to piggyback on both what you and Jarvis said. When we think about community, right, one of the things that we've been remiss at is not including the fathers.
Yes,
right.
totally
really strengthening the father.
Yes.
So the father, because he's raising his child, right? And we appreciate you being here, the holy man. You must be honored. You must be honored. But we often go into the home and think about mom and not think about father. So, you know, CSC has been doing a very good job with actually the Fatherhood program, supporting that initiative. But I think as we think about community work and as we think about families, is to really make sure that we're really centering both parents at the conversation.
Absolutely.
Yeah.
And I think,
I'm sorry, we're out of time. Oh, wow. We could go on for another half hour, for sure. And there's one thing I really want to make sure I get out is the resources that we have for once a family is in crisis are amazing.
Yeah.
But I do want our viewers to recognize and be aware of there's a lot of prevention programming available. Children's Services Council funds family strengthening programs.
Yes.
They fund parenting programs.
Yes.
There's so many opportunities. Once you're aware that it starts at birth, and look, it knows no socioeconomic boundaries. When my daughter was an infant, there was a time I was like, she is yours now.
Yes.
I need to get in the car and drive away because I know I'm not in a good place and I don't want to inflict that on her. And as a teen, it was like, I know you're going to be an amazing woman someday if we both survive that long. It's part of the developmental process, so it's nothing to be ashamed of and afraid of. Reach out for help. There are programs for fathers, there are programs for families to help you manage those teen years. They are tough.
They're tough.
And that senior year in college, when they are, as my husband heard the term, soiling the nest, so that it's easier for them when they leave, it's an interesting time. So don't be afraid to ask for help.
agreed.
Thank you, Jarvis, Harleen, Suzette, and Maria, and all of you for watching as we work together to build a brighter future for Broward's children and families. Please take advantage of the resources available. I've been your host, Cindy Arenberg Seltzer. For this or any other episode of Future First, focus on Broward's children, go to our website, cscbroward.org, where you can access our YouTube channel, follow us on social media, and remember to join us next time on Future First, focus on Broward's children.
Don't forget about being a kid. Don't forget about paying it forward. Don't forget about love and purpose. Service is the mission, baby. Listen with love, listen with love, listen with love. Talk to your kids, ask them what's up, and listen up with love.